Guys, Dr. Claire Brandon here again. So glad to have you back for our third and final break time relaxation module. We've been learning how to take back control of our autonomic nervous system, that fight or flight response, and figuring out ways to utilize relaxation in our everyday life for stress, anxiety, sleep, and just being back in the moment. We've already talked a bit about grounding exercises, using our senses to get back in the moment and get back on track. We've talked about progressive muscle relaxation, a really great technique for helping yourself sleep or even calm down and bring your anxiety to a different level if you're in a stressful situation. So definitely jump back to those, get a little bit of a sense of what we talked about there, and my recommendations for apps that you might be able to utilize on an everyday basis to check out and to incorporate these techniques into your everyday life. Now, today we said we were going to talk about, in our third session, more about breathing techniques and breathing tactics in order to help us figure out ways to, again, take back control of that nervous system when we're in an especially stressful setting. So we're going to learn two different breathing techniques, but first, let's talk about what exactly would be the purpose of learning how to breathe better, in essence, right? Why would we want to be doing this? You know, people tell us this all the time: take a deep breath. Why don't you take a deep breath and relax? And it's easier said than done, especially if you're in the midst of a crisis type of feeling, you're in pain, you're very, very stressed. It can be a lot harder to do than it is to say to take a deep breath and try to calm down. That being said, there's a reason why our bodies choose to make us feel like we can't breathe that well. And that's because we're in that fight or flight response, in essence, running from the bear, or I guess evolutionarily, we were running from the saber-toothed tiger, potentially. When you're running from danger, your whole body takes over and says, heart needs to pump faster in order for us to get more blood to the body, right? That's when you feel your heart racing. Breathing needs to be quicker. So we're, taking in shorter inhales, but more frequently to try to get as much optimized oxygen as possible. And in other ways, our gut doesn't work as much, right? You might find yourself being more constipated when you're under higher stress levels, because I like to joke that we don't poop when we're running from the bear, right? That can really be detrimental. That can be problematic. All these things get in the way of us feeling relaxed, of us sort of having that homeostasis that we would be searching for, that would allow for us to have a better control over our anxiety or mood symptoms, but also our gastrointestinal control. So all that being said, when we again take back control of our breathing, it's really powerful because it reminds our brain, well, wait a second, if I'm inhaling deeper, that equals that I'm able to I need to tell myself I'm not running from anything. There's no danger. The bear isn't there. It doesn't exist. So that's why breathing is an important thing to try to get better at taking control over. And the bottom line is that it just takes practice. You have to be super mindful about being really focused on getting better at breathing, making it a habitual practice, meaning that your brain just clicks right into it and says, hey, we need to breathe differently. Being more mindful and aware that you're not getting deep enough inhales. Some triggers to suggest that would be if you're feeling lightheaded, if you're feeling a little bit of dizziness, that could be that you're actually holding your breath. Now, that isn't to say if you have lightheadedness or dizziness, you shouldn't make sure you talk with your doctor about it. But if there's everything's been rolled out and it's more in the context of anxiety or stress, deep breathing can actually be really, really helpful if you're able to. These techniques can be used whenever you need them, and that could be before an interview, that could be before a doctor's appointment, anytime you really want to get your mindset in a place where you're calm, you're confident, and your heart is not racing, you're breathing, getting good oxygen into your body and your brain would be a good time to utilize these techniques. There's two that I'm going to tell you about. One is probably better for stress moments, and the other one is great for stress moments, but I also find it really helpful for getting to sleep. So maybe you can try them out and see what helps for you the most and what would be the best technique to use for you. The first one is called 4-7-8 breathing. It's exactly how it sounds. You're inhaling for 4, holding your breath for 7 counts, and then you're exhaling for 8 counts. So we're going to do that together, and you're going to get a sense of what that feels like. Take note of what your body feels like right now as compared to when we're done with the breathing technique. So you're going to inhale, counting for 4. So inhale, 2, 3, 4, holding your breath, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4, holding, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. You can do that over and over again. I find that it's very helpful it actually helps you take back control of your heart rate. And as we talked about in the progressive muscle relaxation and the grounding techniques, our vagus nerve actually helps to regulate all these fight or flight responses, and this deep breathing actually takes back control of that. So test that out, see how you feel on that, and you might find yourself experiencing a calmer sensation just because you are able to take back control of things like your heart rate. Now, the other alternative type of breathing, which you can use both of them, you can use just one of them, it's just good to have some different options. It's called diaphragmatic breathing. And sometimes it's also called belly breathing, because we want to think about inhaling as much air as we can so that we can imagine our body expanding and taking in as much air as possible. Now, that expansion is not really your lungs necessarily, it's your diaphragm. And I want to share with you a diagram here that will be helpful in us identifying what exactly that looks like, so that you can maybe have a bit better of a sense of what's going on in your body when we're talking about diaphragmatic breathing. So I'm going to share here and look at this diagram for a moment. When we're inhaling a deep breath is coming in. Let's see if I can use a pointer here. Breath is coming in, and we are going to expand our diaphragm. So our diaphragm is probably one of the larger muscles in our body, and it goes all the way across the bottom of our lungs. We're breathing in, and the ribs expand a little bit because the diaphragm is allowing there to be some suction, some more room to expand our lungs. When we breathe out, our diaphragm is going up and it's relaxing. It's actually sort of springing back up, just like you would see in a pump that's moving up and down. So inhaling, your diaphragm goes down. Exhaling, your diaphragm is going up, and then your ribs are also contracting a little bit because of all those muscles that are connected. So that's diaphragmatic breathing. And when we think about this, it's really, really powerful because we actually, again, have control over our diaphragms. We can re-regulate that. And when you take a deep breath in, imagine your diaphragm expanding down. It's really helpful sometimes to put a hand on your heart and a hand on your belly so that you can experience how much expansion your stomach has when you're inhaling, and that's due to your diaphragm. When you're exhaling and squeezing all that air out, your diaphragm is moving up. And so you can imagine this sort of rhythmically going up and down, and it can be a form of meditation to do that. So I like to think about this in counts of 4. It can be really helpful to give yourself a number if you like some, sense of direction there. So inhaling, counting to 4, expanding as much as you possibly can, your belly. And then exhaling, thinking about the diaphragm scooting up, rebounding, having a spring back feeling, and letting all that oxygen get out of your system. So you can do that over and over again in counts of 4. So inhaling, 2, 3, 4. Exhaling, 2, 3, 4. And doing that over and over again can be super helpful to decrease panic, to decrease stress, to help yourself just be calmer in the moment. Some of my favorite apps for that actually is the same one we talked about, grounding. It's called Clear Fear. And again, it has actually a little bubble that you can watch go back and forth, expand and contract. It kind of represents the diaphragm. You can watch that go in and out and breathe along with it so that you don't have to count. You're just watching this, especially if you're a visual learner like me. That can be really helpful. And the same thing goes for Insight Timer, actually listening to breathing meditations, coaching you through breathing. Can be really, really powerful and helpful, especially when you don't feel like you quite have the ability to pull that out of your hat when you're not with the app. This can be a really great moment to take control with using the help of the apps. I hope these techniques have been helpful. I hope they've helped you calm down a little bit, especially if you're going through pain, physical sensations, any kind of anxiety, depression, mood symptoms. As always, consult with your doctor. I would encourage you guys all to check out mental health options in your area, especially if you've never been to a psychiatrist before. It might be really useful. I see a lot of patients with chronic illness and gastrointestinal illness. You can get more information from me on my website, which is www.clairebrandonmd.com. And you can send a message to my practice through that if you're looking for resources. I also have Instagram called with my name, Claire Brandon MD, or the podcast, The GI Psychiatrist, and its corresponding Instagram, The GI Psychiatrist. So hope to see you guys there soon. Thanks so much for letting me be part of your day. And I hope you've learned a lot and can take these into the rest of your day and week and go forward and teach other people some of these techniques too. Take care, everybody.